Hi, everybody. My name is Lisa Kessler from Kessler Insurance, and I'm here today on behalf of Cheers for Charity New Hampshire. And I get to be here again with my dear friend Joanne. Hey, Joanne.
Lisa, hi, thank you. Yes, I'm Joanne Burchuk. I'm with Lighthouse Physical Therapy. And today, on behalf of Cheers for Charity, we want to welcome Sandi, who's with the Joan G. It's Lovering, right? Health Center. Did I say that correctly?
You did.
Awesome. Well, we welcome you here, and please introduce yourself and tell us a little bit about what your health center does.
Sure. Thank you so much, Joanne and Lisa, for having me. So yes, my name is Sandi Denoncour. I'm the executive director at the Joan G. Lovering Health Center. We affectionately call ourselves the Lovering, so we'll use that going forward. We're a nonprofit reproductive and sexual health center located in Greenland, New Hampshire. We've been serving the New Hampshire Seacoast for over 40 years. We used to be known as the Feminist Health Center of Portsmouth. So our model began out of the 1970s and 80s feminist movement, and we have adapted and stayed strong ever since. So we provide confidential, comprehensive, and accurate sexual and reproductive health information and services to all people in a supportive environment. It's our passion to honor, respect, and advocate for the right of everyone to maintain freedom and choices regarding their own sexual and reproductive health. Our services include what many may know as typical family planning services. So access to birth control and contraceptives, gynecological exams and health screenings, including cervical cancer screenings. We also provide sexually transmitted infection testing, treatment, and prevention services. That includes PrEP, which is pre-exposure prophylactics for HIV transmission prevention. And then in 2020, we started a trans care program. So specifically taking care of transgender, non-binary, gender non-conforming folks in our community, including gender-affirming hormone therapy. That program is growing consistently, which indicates to us that what we knew was true, is that there's a lack of services for the trans community in our area. And lastly, we do provide pregnancy termination or abortion services, both medical abortions and procedural abortions. And we're proud to be part of that continuum of care in our small.
Yes, well, you serve so many women in different capacities, which is absolutely amazing. And thank you for all those services that you offer to the women and provide much needed services. So that's interesting on, the whole transgender and all of that, it's good to see so much more of a focus now in helping that. And I think it's been an underserviced area for so many years, and it's now finally coming to light, and so happy you're there to provide additional. And I'm assuming is part of this counseling too, or just in helping with them physically?
So it's a great question. And everything that we do is focused around the clinical service provision. So we are not a behavioral health center or a mental health center. If people need counseling services, we collaborate with our community partners, so the community mental health centers or local providers who we consider trans competent. So people who are equipped as we are to speak the language, be patient-centered, trauma-informed. Unfortunately, many of our trans care patients have significant trauma based on past experiences in the medical community that may not recognize them for who they are or create spaces where it's safe to be who they are. So we much of our care involves discussions of those and barriers to care. And counseling can often be a wonderful adjunct to what we do. So we will help people find that in any case where it's needed.
Go ahead, Joanne. Sorry.
Oh no, you adjusted your mic, so I figured go ahead. Yeah.
So tell me, is it always women that you serve? Just to clarify? Okay.
No, so we provide services to all genders, and interesting number of people come to us who identify as male, and we provide all of our routine services to all genders. So we often say, you come to us as you, and we will treat appropriately and accurately the body that you bring with you. And we do not need your gender and your physical body to necessarily match based on our assumptions. And it's truly that important that we open the conversation to removing gender assumptions to all of our services. We work very hard on that. I will say that traditionally, and does still remain true, that the majority of the people who seek our care identify as female and are between the ages of 15 and 44. So primarily the target population for traditional family planning services and feminist healthcare. That is absolutely true. And what we really appreciate is the opportunity to expand that model, to say, how do we take the feminist ideals of informed decision-making, informed consent, and independent decision-making, and provide that for other people who may have been disenfranchised from the healthcare system or not empowered to access healthcare in a supportive environment. So the other way that we guarantee access, are two things we do that I think are important. One is that we have a very significant outreach program. So we table at events. So you'll find us at pride marches, and you'll find us at recovery rallies, and you'll find us talking to UNH classes, and you'll find us in lots of different areas where we may find clients who need our care, but also we find people who simply don't understand what the full spectrum of reproductive healthcare includes and how important it is as a component of overall healthcare. So we do a significant amount of outreach. We've maintained that even during COVID, even though we've had to adjust where we are and how we reach people. But we've been successfully connecting in the community in that way for decades. And it is the foundation of our referrals still remains word of mouth. We receive referrals from other healthcare providers, but word of mouth is really the most significant way that people find us, which means to us that our care is respectful, it's appreciated, and people are recommending us to people that they love and care about. The other thing that we do that's important is we have a sliding scale fee system. So if somebody's uninsured or underinsured, they can receive care from us regardless of their ability to pay, and we'll work with them to create a fee schedule that meets their income level. So it's based on the federal poverty guidelines, and we take into account folks' reported income when they come to see us. If they're eligible for Medicaid, we'll encourage them to apply and try to assist them to do that as well. So we really want to reach folks who may not have an opportunity to receive the healthcare services we provide due to their lack of ability to pay for services. We will serve them. So we encourage people to make a referral to us without fear that cost is a barrier.
Which is great. Now, do you also accept other insurances or just the Medicaid?
We do. We accept all the Medicaid plans, New Hampshire Medicaid, Maine Medicaid. We have clients who come to us from Southern Maine because we're accessible and close. And we're also close to the border of Massachusetts. So we see clients from Massachusetts. But we accept most private healthcare insurance plans and Medicaid.
So as far as you just brought up, the payment and stuff. So I'm also in the medical field, so you obviously have to cover all your costs, and when you're doing the sliding scales, it does require extra funds. So are you funded in part by the government, or how do you guys normally handle your financial pieces?
Right. So that's a very timely topic for us. We've been participants in the state of New Hampshire's family planning program for a decade. But this past calendar year, some folks may know that our contract for family planning services was not approved by the governor's executive council. And that's true of our center and the 3 other contracts for providers who also provide abortion services. The contracts were upheld for all of the family planning contractors who do not provide abortion services. So it was very much it was very much detached from the actual value and success of the family planning services that were provided under the contract, and very much about where we are politically in our state. So unfortunately, that contract accounted for about 20% of our operating revenue. And so we have had tremendous community support in light of those decisions to help us maintain services and the reduced fee schedule, because the family planning contract was designed to support services that were otherwise not paid by clients directly because they were low income or uninsured. So that's been a real turning point here in New Hampshire. We're at a point we've not been in years. So right now, unfortunately, grant funding and foundation funding makes up a larger percentage of our operating budget than it has in past years. And donor funding, so private donors, support a much more significant portion of our budget this operating year than in past years. And that's out of necessity, but it's also a tribute to the amazing community support that's out there, that folks have responded as they have. But we know that that need for support will continue through this year and into next year. So we're very appreciative of where we are. And we are hoping to expand services a bit. We got very lean through COVID, as most organizations did. But as we come through COVID, and we hope to be in the recovery phase from COVID soon, we want to expand our services and stretch back out to a bit wider hours, availability, because access is so crucial for the populations we serve. So while we're financially in a unique position, somewhere we haven't been in years, we're also optimistic about where we can be in the next 2 years.
Wow. So you said word of mouth is such a big thing, but if people hear about you through us and then they're, curious to learn more, how can they get more information about the services that are available for your organization and all those other details? How do you communicate with the community?
Absolutely. So there are a few ways. The first and easiest way is to visit our website, which is jglhc.org. So the initials of Joan G. Lovering Health Center.org. And we're also on social media. We have a fairly robust social media presence. You can find us on Facebook. You can find us on Instagram at Lovering Health. And we use those platforms to share information about our services. We also use those platforms to provide general sexual and reproductive health education. And we also use it to share some calls to action. So if you're passionate about our mission and you want to be active, you can support legislation that defends access to reproductive services, and you can register opposition to those that don't. And we try to make it easy for people to understand how to get politically involved. That advocacy is so valuable to us. Funds are valuable, but advocacy is what's going to preserve our existence in this service industry for the future. And so we appreciate everybody's energy in any way that they can provide it. But our website has links to make donations, and we appreciate them. And we have hundreds of donors. Some of them are very small amounts once, some of them are small amounts every month, and some of them are larger donations. So we appreciate everybody's ability to help. And folks are also welcome to call our office directly at any time and to clarify services, ask about eligibility for services. We're happy to answer any questions.
That's awesome. Thank you so much, Sandi. I really appreciate what you guys do to try to keep more people in our community healthy, and through education and all the services that you provide. And we're really grateful for you taking the time to talk to us today. This has been really informative.
Great. Thank you so much for having me. Bye-bye.